I was a football player, wrestler, power lifter, golfer through my whole athletic career, and they all kind of transformed one after the other to never really give my body the necessary break that it needed. Trying to get treated for a groin pull, and I really didn't know what was going on there, and then we looked in it a little further and we found from x-rays that I was bone on bone.
A joint is made out of bones and cartilage. When we say somebody's bone on bone, that means that they don't have any cartilage left.
After I found out I needed hip replacement, I discovered that I really wanted to do the anterior approach.
The one benefit of the anterior approach is that there are no restrictions after the surgery is done, and generally the recovery is a little bit faster for the first couple of weeks.
Dr. Samujh and myself discussed going to Allentown for the surgery.
There are all private rooms here. All the nurses are orthopedic nurses. They are familiar with taking care of hip and knee patients, and people are pretty happy with their experience.
So it was just a great experience. The fact that Coordinated Health is a specialty hospital was really comforting to have the surgery at that location.
Larry did fantastic. The next day after the surgery, I called him on his cell phone to see how he was doing. It was 10 o'clock in the morning, and he was already halfway home.
It was, I want to say, comical. People would see me and go, "You just had hip surgery?" They couldn't believe how fast it was.
It's well worth it to have your hip replaced so you can continue doing these activities while you're still younger.
If I hear somebody about having a hip problem or any kind of orthopedic problem, he's 100% recommended.